All right, good afternoon, everyone. Welcome to our final session in our current series of Boosters and Beyond, addressing key challenges. As you know, we've been going through the CDC's core infection prevention and control practices for safe healthcare delivery in all settings. Today, we're going to be talking about occupational health, and we have Leslie Morrissey here to provide us with today's content. But before we get started, have a couple of action items to get through. If you're not familiar with who the IPRO QIN-QIO is, IPRO holds the federally funded Medicare QIO contract for the 12 regions shown here. IPRO specifically helps support New York, New Jersey, and Ohio. Health-centric advisors help support Connecticut, Maine, Massachusetts, New Hampshire, Rhode Island, and Vermont. And Clarent helps support Maryland, Delaware, and the District of Columbia. Together, we are three organizations under the IPRO QIN-QIO banner. So if anyone asks you if you know what IPRO is, or Health-Centric Advisors, or Clarent, you say yes. And with that, I'll pass it over to Mary Ellen for our booster update for COVID-19.
Thanks, Josh. Just so folks know, hospitalizations are down as of the 12th of April. 7-day average is at 1850. It's down 14.3%. Bivalent boosters continue to slowly tick up. 55.5 million have received the updated booster dose, with 42.6 of adults 65 and older having received that bivalent booster. The variant summary: the XBB strains remain the most dominant at 97.7%, and that's been really consistent over the last few months. Next slide. And we remain at 54% for nursing homes reporting to NHSN their up-to-date COVID vaccine data for nursing home residents, and they have not updated the site as of yet on the CDC. I think they're slowing down with the public health emergency coming to an end, but the data is still from the 2nd of April, and it's at 54%. So I expect next week we'll probably have an update on that. Thanks.
Perfect. Thanks so much, Mary Ellen. And before we get started into today's content, we have a very special guest, Brooke Story here, who is the Director of Nursing of Ross Manor. And we brought her here today to talk a little bit about the Power and Care Ambassador program that they're using in their facility to improve the COVID-19 bivalent booster rates for their staff. So, Brooke, I'd like to pass it over to you if you could tell us a little bit about what your facility is doing.
Sure. So like Josh said, I'm the Director of Skilled Nursing, and I am the Infection Preventionist here at Ross Manor. So today I'm going to speak a little bit to the Power of Care Ambassador program that was started by the Maine Long-Term Care Ombudsman program. So in October of 2022, we were reached out to by the Ombudsman program in order to partner with them to up our vaccination rates in the Ross Manor facility. So for those of you that don't know, Ross Manor is a 103-bed facility. It has, we take long-term care residents, and we take skilled nursing residents as well. So let's see. So we partnered with the Ombudsman program, and I was super excited to partner with them just because as an infection preventionist, I've kind of seen, things go a little stagnant with our vaccination rates, whether this be, staff resistant to becoming vaccinated with the booster, or I think probably, staff has just really felt like we're kind of pushing it on them and they're a little resistant to it. So this campaign aimed to increase COVID vaccination rates in direct care workers, and it developed some education and outreach materials to provide staff with, as well as administration. And I think the primary goal, at least I feel, was to really normalize the COVID-19 vaccination as a standard immunization. We'll move on to the next. So like many nursing homes in the state of Maine, we have definitely seen some challenges. And these challenges have been, I think, primarily the state requirement of at least the primary series to work in a healthcare facility. We definitely lost a lot of employees due to this. And then just continued promotion and education being pushed to employees. I think they really felt like management was really nagging them to become vaccinated. And I think a lot of it was just lack of education and the misinformation floating about staff and residents had contracted COVID-19, even though they were vaccinated. So a lot of staff just felt like the vaccination just didn't work. So they were really discouraged in regards to that and were really resistant to getting the next booster. All right, so in partnering with the Ombudsman Program and the Power of Care Ambassador Initiative, Ross Manor was able to vaccinate nearly 20 staff members with the bivalent booster, which was a huge success. Now, there's no way to tell, if this was directly related to all of the information and the materials that were provided with the Power of Care Ambassador Program, but there seems to be a very strong correlation. Staff members now claim that they have a better understanding of how the vaccination actually works. And additionally, we were able to increase our resident vaccination rates as well. So how did we do it? So we used all of the information that the Ombudsman Program provided us with, whether that be flyers, posters, brochures, business cards, everything. We just put it out there for our residents, our staff, and even visitors. So we put brochures and cards in highly trafficked areas. We put a little station out at our main entrance. We put it in break rooms. We also put them in our back hallways where our staff schedules are kept. We also added brochures to our general orientation packets just to really start the conversation of boosters and COVID vaccinations early in the employee process. We placed signage at main entrances. The Ombudsman Program provided us with a beautiful poster to place out front with nice imaging and nice wording. That really was just a conversation starter for staff and family members as well. And I think just the wording of the Power Care Ambassador Program was what really hit home to a lot of our staff. They are extremely close to a lot of our residents, and they'll do anything they can to protect them. So the wording was really important to them. So a lot of the wording was, those who need you to be healthy. And the most important and hard hitting for our employees was, if not for you, for them.
Perfect. Thank you so much for sharing your story, Brooke. So what I'll be doing is I'll be sharing the website to the Power of Care website to everyone who participated on the call as well after the session. If you're interested in checking out any of the materials, more than welcome to go there. And from now, I will pass it off to Leslie to get into today's topic for occupational health. Leslie, over to you.
Great. Can you hear me?
Yes, we can.
Thanks so much for asking me to speak to you today. I am very happy to do so. So we really are very weird, aren't we? We work when we don't feel well and we stay home when we do. Next slide, Josh, please. The goal of this presentation is to define the components of an occupational health program, review immunizations for healthcare workers, and identify educational resources. This slide, there's some resources that you should review. There are a lot of updated recommendations that are intended to guide occupational health and management of exposed or infected healthcare workers who may be contagious to others in the workplace. Next slide, please, Josh. This slide is pink for my soon-to-be grandbaby. The prevention of, so components of an occupational health program. The prevention of infectious disease transmission among workers is a critical component of the safe healthcare delivery in all settings. Some components of an occupational health program are on this slide. Having policies aimed at reporting staff illness and following work restrictions per nationally recognized standards and guidelines. You want to assess risks for TB in your facility as well as the community and nationally, as well as screening your staff per guidelines. Monitoring and evaluating for clusters or outbreaks of illness among staff, and implement an exposure control plan in order to address potential hazards posed by blood and body fluids. Some examples include dialysis, glucose monitoring, and any other point of care testing. Facilities should ensure staff follow policies and procedures, as well as have competencies for hand hygiene and appropriate use of PPE, as well as injection safety and point of care testing. Residents and families should receive education on hand hygiene, especially before eating and after using the restroom, as well as education on cough etiquette. Your facility should implement a process for sick leave policies, encourage healthcare personnel to stay home when they develop signs and symptoms of acute infectious illness, such as fever, cough, diarrhea, vomiting, to prevent the spread of infections to patients and other healthcare personnel. Some non-infectious elements of occupational health include slips, trips, and falls, patient handling injuries, chemical exposures, healthcare personnel burnout, and workplace violence. Josh, next slide, please. So there was an article from AHRQ that states working while ill is known as presenteeism. It is a particularly pervasive problem in healthcare with serious consequences. When workers provide care while experiencing symptoms of infectious disease, they put their patients and their colleagues at risk. Harvard had a workplace and health report which found that 73% of employees stated that they were not sick enough to stay home. 37% wanted to save days for another time. 28% said there was no one there to cover their workload. 20% claimed that they had too much work to do to complete, and 20% said not taking time off would help them get ahead. Providing direct patient care during the COVID-19 pandemic, workers often remained at work to care for their patients at a time when their own physical and mental health status prevented them from being fully productive. Historically in healthcare, calling out is really very poorly regarded and deemed unprofessional by many. Just like in the hospital and in the nursing home, you're expected to be there when there's 2 feet of snowfall. It's just what we do, the culture of healthcare. The COVID-19 pandemic was very challenging to get healthcare workers to self-report illness and make them stay home to keep patients safe. Next slide, Josh, please. Some examples of regulations requiring education and training for employees include OSHA's bloodborne pathogen standard. Some training education elements includes the epidemiology, modes of transmission, Hep B immunization, and post-exposure management. The personal protective equipment standard. You want to ensure that you're educating on when, what, and how of your PPE use, as well as proper care and maintenance of PPE, as well as knowledge of the PPE limitations. Respiratory protection education, respiratory protection standard. You want to educate on hazards of and use of respirators. Next slide, please, Josh. Thank you. Your TB infection control plan should be based on 3 levels of hierarchy and control measures. So you need an administrative measure, such as conducting a risk assessment, ensuring availability of recommended lab testing, proper cleaning, sterilization, disinfection of equipment, education and training, and counseling of healthcare personnel, environmental controls, such as controlling airflow to prevent contamination in air, in using airborne isolation rooms and cleaning the air by HEPA filtration or ultraviolet germicide eradication. Use of respiratory protective equipment, such as N95 masks and eye protection, training of healthcare personnel. Next slide, please, Josh. Thank you. You need to have a policy to assess your healthcare personnel's risk for TB based on regional and community data. Does your Department of Health supply that data? Where are you getting that data from? You want to ensure that you have an individual risk assessment for your residents. There is an example of that on this slide. Treatment of latent TB infection greatly reduces the risks of TB, that the TB infection will progress to disease. Who do you use as a referring facility for TB cases? CDC updated TB guidelines on May 17th, 2019. Please visit the CDC page. It has lots of great resources. Like, did you know that annual TB testing of healthcare personnel is not recommended unless there's a known exposure or ongoing transmission at your healthcare facility? Next slide, please. So there's some great self-study modules on TB. This series consists of a total of 9 modules that are separated in 2 different courses. There are continuing education credits that are offered. There's also a lot of education and handouts to educate your staff, your residents, as well as families. Next slide, please, Josh. Thank you. One of the primary responsibilities of the employer under the respiratory protection program is to develop and implement a plan that details work site specific procedures and practices in regard to respirator use. This training from OSHA is a great training for you to take on respiratory protection. Next slide, please, Josh. As IPs, you want to know the various components of your OSHA bloodborne pathogen standard, including training requirements and documentation. Is your bloodborne pathogen exposure control plan up to date? Where is it located? You want to ensure that the sharps disposals are below the full line. Ensure that your staff are using gloves in anticipation of blood and other potentially infectious materials. You want to reduce barriers to safe injection practices and shop safety. OSHA requires that you maintain a shop's injury log, train staff on engineered safety devices and safe disposal of sharps. Don't share insulin pens or glucometers. If you must share a glucometer, you must know what the manufacturer guideline is for cleaning. Maybe create an education, post it next to where the glucometer is stored with a picture of the cleaning product and a picture of the device, as well as the contact time that is very clearly noted. Next slide, please, Josh. In March of 2023, CDC issued new hepatitis B screening and testing guidance that recommends universal Hep B screening for all adults, as well as risk-based repeat testing for selected groups. You want to utilize a 3-test panel, which includes your hepatitis B surface antigen, antibody to Hep B surface antigen, and total antibody to Hep B core antigen. In these recommendations, the term screening refers to conducting serologic testing of asymptomatic people not known to be at increased risk for exposure to hepatitis B. Next slide, please, Josh. On this slide is the rationale for the new recommendations. Next slide, please, Josh. Hepatitis C is on the rise in the United States in 2020. 57% of new Hep C infections occurred among adults ages 20 to 39 years old. Patients with Hep C often have no symptoms. Many patients with acute or chronic hepatitis C don't look sick, and therefore they don't know that they're infected. All adults and pregnant patients should be tested for hepatitis C. Hepatitis C can be cured in more than 95% of cases. Next slide, please, Josh. On this slide is a great slide because sometimes it's really hard to understand the meanings of serologic markers and interpreting those serologic test results. This training is comprised of 5 animated videos, and it helps you to understand the lab tests. Great training. You want to make sure that you're utilizing it. And also on this slide is a CDC resource for post-exposure prophylaxis called a PEP line. It provides clinicians with access to treatment protocols following a blood exposure. Next slide, please, Josh. Occupational HIV transmission is extremely rare. Only 58 cases of confirmed occupational HIV in healthcare personnel have been reported in the United States. The risk of occupational HIV transmission varies by the type of exposure. So splashes with body fluids, it's near 0. Fluid splashes with intact skin or mucous membrane, extremely low risk, even if blood is involved. And percutaneous needle stick injury is less than 1%. You want to review how your organization can make a difference for HIV occupational exposure. Next slide, please. Influenza and pneumococcal immunization. Long-term care residents and staff should be empowered to make informed, evidence-based decisions related to vaccinations. You need to ensure that you address flu and pneumovax in your IP plan. Measure the percentage of healthcare workers who are up to date with flu and COVID vaccines. There are 2 kinds of pneumococcal vaccines that are used in the United States to help protect against pneumococcal disease. You have pneumococcal conjugate vaccines and pneumococcal polysaccharidosis vaccines. These vaccines protect against many, but not all, of the types of pneumococcal bacteria. There's a great resource that the CDC has called a PneumoRec Vac Advisor. It's a mobile app. It helps vaccine providers quickly and easily determine which pneumococcal vaccines a patient needs and when. Next slide, please, Josh. Healthcare worker vaccine rates are declining, as you heard from the previous speaker. The influenza data from nationally shows a decline for the percent of the workforce who are vaccinated for flu. Your QIN-QIO has lots of resources and education to increase your vaccine rates in your facility. And also, as we heard from the previous speaker, there's lots of resources that she put in place to improve her rates, which is phenomenal. Next slide, please, Josh. This slide talks about vaccine preventable adult diseases. There's lots of vaccine preventable adult diseases. Next slide, please. This slide, healthcare workers are at risk of they're at risk for exposure to serious and sometimes deadly diseases. If you work directly with patients or handle material that can spread infection, you should get appropriate vaccines to reduce the chance that you will get or spread a vaccine preventable disease. Protect yourself, your patients, your family members, and make sure that you're up to date. Next slide, please, Josh. Proper vaccine administration is critical to ensure that the vaccination is safe and effective. CDC recommends that all healthcare personnel who administer vaccines receive comprehensive competency-based training on vaccine administration and policies and procedures before administering the vaccines. This is a sample of a free vaccine administration called eLearn. It is available. It offers CEUs for healthcare personnel. Also, there is a training called You Call the Shots. It's a 10-module education on storage and handling of vaccines. Next slide, please, Josh. This slide comes from Project First Line. This is a tool that you can use, a checklist for using multi-dose vial infection control procedure. Next slide, please, Josh. Vaccine storage and handling. The CDC has a great vaccine storage and handling toolkit, as well as many other resources. The Pink Book also has resources for vaccine storage and handling. Your state Department of Health will want to ensure that you have a plan for vaccines in case of an emergency if you lose power. So know what it is that you need for vaccine storage and handling. Next slide, please. Here's some strategies for improving healthcare provider immunization coverage. Next slide, please. COVID-19 information, guidance and mitigation for preventing the spread of COVID-19 in the workplace. So in addition to ventilation improvements, a layered approach includes physical distancing, wearing face masks, hand hygiene, and vaccination. Project First Line has great training resources in regard to all of those approaches. Next slide, please. NHSN has updated tracking worksheet for COVID-19 vaccine. COVID-19 and flu must be reported into NHSN, but they did update those tracking worksheets in February. Next slide, please. Vaccine information sheets. So it is required under the National Childhood Safety Injury Act to provide relevant current education on vaccine information prior to administration of each dose of the vaccine. So immunize.org is a great, phenomenal resource for VIS statements in all different languages and immunization schedules, and as well as the CDC has information too. Next slide, please. NIOSH created education on for nurses on shift work and long hours. This education offers some realistic strategies to ensure safety and a healthy workplace. And by extension, a safe and healthy community. So this training consists of 12 modules divided into 2 parts, and it identifies strategies that nurses can implement in their personal lives to reduce risks from shift work and working long hours, and also CEUs. Next slide, please. Musculoskeletal disorders are a major concern in occupational healthcare. Injuries occur frequently and are often due to repeated handling of patients, which involves heavy manual lifting when transferring or repositioning, and working in extremely awkward positions. Nursing assistants experience the highest rate of musculoskeletal disorders of all occupations in 2020. Some states have legislation in safe patient handling. You want to know what your individual state requires. Next slide, please, Josh. OSHA created guidelines on safe patient handling for the prevention of musculoskeletal disorders. It's a great resource to implement in your facility. Also, make sure that you're looking at the manufacturer instructions for storage, cleaning, and disinfection in between patients. Next slide, please. Emergency preparedness and response. Emergencies can create a variety of hazards for workers in the impacted area. Preparing for an emergency incident plays a vital role in ensuring that your workers have the necessary equipment to know where to go and how to keep themselves safe when an emergency occurs. Next slide, please. Prevention of workplace violence. OSHA is considering a new standard to protect healthcare and social assistant workers from workplace violence. This is a draft regulatory framework called the Prevention of Workplace Violence in Healthcare Social Assistance. And it would cover employers in healthcare and social assistance sectors whose employees face a heightened risk of workplace violence. In 2004, OSHA issued guidelines for healthcare and social care workers. And this guideline is a great framework for thinking about challenges of workplace violence prevention. We're seeing lots of workplace violence lately. Next slide, please. This is special education on it's workplace violence education, especially for nurses. It offers CEUs and created by the CDC and NIOSH. Next slide, please. Moral injury is understood to be the strong cognitive and emotional response that can occur following events that violate a person's moral or ethical code. An example of this would be healthcare staff who are worked during the COVID-19 pandemic, who might experience moral injury because they perceive that they received inadequate protective equipment, or when their workload was such that they deliver care at a standard that falls below what they would consider to be good enough. International literature indicates that moral injury might be an important and public health concern. The World Health Organization created our Duty to Care report. This report examines the impact of the pandemic on mental health of healthcare workers in the workforce, and it highlights effective interventions to support mental health. Next page, please. Novel and emerging pathogens. Infection prevention and control guidance for novel and emerging pathogens should be included in your program, as infection prevention and control process for novel pathogens may vary from your standard practice. Occupational infection prevention and control recommendations for healthcare personnel will be necessary for monkeypox, Ebola, COVID-19. This part is just good to know. So the National Commission of People's Republic of China reported a confirmed case of human infection with avian influenza H3N8, the bird flu, on March 27, 2023. The patient was an adult with multiple underlying conditions who later died on March 16, 2023. This is the third human infection with H3N8 bird flu virus and the first fatality that was ever reported. The H3N8 virus is not thought to pose a risk to the health of US public at this time. It is not an occupational hazard at this time, but it's good to know and know what's coming out and be aware of the viruses that are happening in the community. So that way you can put an effective intervention in place quickly. Next slide, please. OSHA has training education centers located at various points around the country. Next slide, please. This is a workbook, fundamentals of total worker health approaches. It's there's essential elements for advancing worker safety, health, and well-being, and prioritizes a hazard-free work environment for all workers. Next slide, please. Hand hygiene is the most important method for prevention of infection transmission in healthcare. However, compliance with this simple technique really is suboptimal. This uses an interactive audit and feedback strategy via an innovative SPLAT game involved to improve hand hygiene, adherence, and they used it in a large academic medical center. The players were instructed to observe others through the course of their day and to splat them by placing a sticker on their shirt when they failed to perform hand hygiene, as indicated on the card. Players in the team were told to remind teammates who failed to perform hand hygiene with no consequence and to splat the members of the opposing team for failure to perform hand hygiene. Each round of the game lasted for one shift. I think that this game is phenomenal, and it gets everybody on your unit that you're doing this with to think about hand hygiene, want to audit other players and other workers for hand hygiene, and make it fun and not make it where they're like tattletaling on each other. Next slide, please. As a healthcare worker, you give everything of yourself to others. Give yourself permission to take care of yourself too. Make time for a hobby you enjoy. Go to sleep a half hour earlier. Take a walk outside, try a yoga class, meet a friend for lunch. Take care of you. Do you have any questions?
Thank you so much, Leslie. Anyone have any questions or anything that they want to share? Sheila says that she loves the last two slides. Lynn McNichol asks if you know how long the hepatitis videos are.
So I think that those hepatitis videos are about 10 minutes long.
And then a comment from Mary Ellen. Great presentation. All right. If there's any other questions, feel free to just put them in now. I do have our contact information that I'm showing at this point. Feel free to reach out to us and share any questions or comments with us. We'll happy to help support you with anything that you might need. Wanted to share that next week we are beginning our new series with the Boosters and Beyond, and we're going to be talking about antipsychotics and dementia care for the next series. So have a lot of great content planned for you all. Looking forward to getting into delving into that new topic. We do have this recording for anyone who's missed today's session. If you believe that they would benefit from today's session, we are playing this live again tomorrow at 3:30 and for the recording. And then, of course, we have our IP3 sessions each Thursday at 11 a.m.
Thank you.
And that'll be it. Thank you so much, everyone. Have a great day.